Have you ever heard of a rare disease called sarcoidosis? No? Well, you're not alone. Many people haven't. It's a condition that's as unique as its name, and it's caused by inflammation. The fascinating, or perhaps perplexing thing about sarcoidosis is that it can occur almost anywhere in the body. However, it has a certain fondness for the lungs and lymph nodes. Now imagine tiny lumps of inflammatory cells forming in your lungs. These little lumps are called granulomas. They're like tiny unwanted guests that in most cases decide to leave on their own, but sometimes they overstay their welcome, causing the lung tissue to remain inflamed, scarred, and stiff. This condition is known as pulmonary fibrosis, which can affect your breathing. In rare instances, pockets can form in the air tubes of the lung and become infected, a situation known as bronchiectasis. Now that you have a basic understanding of what sarcoidosis is, let's delve deeper into the causes. The exact cause of sarcoidosis remains a mystery to medical professionals. This rare disease, characterized by inflammation and the formation of granulomas, primarily in the lungs, is a puzzle that continues to baffle scientists and doctors alike. The mystery deepens when we consider that sarcoidosis can occur almost anywhere in the body. While the exact cause is elusive, researchers have some theories. They believe that sarcoidosis may be triggered by an array of factors. These could include bacteria, viruses, or certain chemicals. Additionally, a person's genetic makeup may also play a role in the development of this condition. We know that sarcoidosis often occurs in families, suggesting a genetic link. However, it's important to dispel any misconceptions that may arise. Sarcoidosis is not a contagious disease. You cannot catch it from someone else, nor can you pass it on. This characteristic further distinguishes sarcoidosis from many other inflammatory diseases. Although the exact cause is unknown, understanding the symptoms can help in early detection and treatment. So, let's delve into these symptoms and how they can impact those affected by sarcoidosis. Many people with sarcoidosis do not have symptoms, which can make it difficult to diagnose. It's a sneaky condition that way. But when symptoms do appear, they can be as varied as the organs it affects. Let's start with the lungs, the most common site of this inflammation. Picture this. You've been experiencing a persistent dry cough, one that just doesn't seem to go away. You might brush it off as a minor annoyance at first, but then chest pain sneaks in and suddenly, climbing a flight of stairs feels like you've run a marathon. This is shortness of breath, another symptom of pulmonary sarcoidosis. Now, what if sarcoidosis decides to leave its mark on the skin? Well, it can create lesions, rashes, or nodules. These aren't just your average blemishes, they are signs of inflammation within. But wait, it doesn't stop there. Sarcoidosis can also manifest in more general, systemic ways. You might feel a constant sense of fatigue, like you're walking through a fog, even after a good night's sleep. You could have a fever that comes and goes without any other signs of an infection. You might notice a sudden, unexplained weight loss. Or perhaps you find yourself waking up in the middle of the night drenched in sweat. Yes, night sweats are also a symptom, so you see, sarcoidosis can be quite the chameleon, blending its symptoms with those of other conditions, making it a challenge to pinpoint. But don't worry, medical professionals have their ways to catch this elusive condition. Given these wide-ranging symptoms, how do doctors diagnose sarcoidosis? Well, that's a great question, and it's what we'll delve into in our next scene. Stay tuned. Diagnosing sarcoidosis involves a medical history, physical exam, and various tests. Now let's delve a bit deeper into this. The diagnosis of sarcoidosis is usually initiated with a thorough medical history and physical examination. Doctors often look for signs of inflammation such as rashes, redness, or swelling. Then comes the testing phase, which may include chest X-rays and CT scans to identify any granulomas or other abnormalities in the lungs. Pulmonary function tests are also used to assess how well the lungs are working, particularly their ability to hold and circulate air. In some instances, a biopsy might be performed to confirm the diagnosis, where a small sample of lung tissue is taken and examined for granulomas. Now, moving on to treatment. The primary aim is to control symptoms and improve organ function. This often involves the use of steroid medications or other immune-suppressing drugs. Steroids work by reducing inflammation and suppressing the immune system, thereby preventing it from causing further damage to your body. There are cases where no treatment is necessary. This might seem strange, but remember, granulomas often heal and disappear on their own. In such instances, doctors might suggest a watch-and-wait approach. They will monitor your condition regularly and only start treatment if symptoms worsen or become bothersome. For those who experience severe symptoms or complications, rehabilitation programs or oxygen therapy may be recommended. Rehabilitation programs can help improve lung function and overall fitness, while oxygen therapy ensures the body gets the oxygen it needs. Remember, every case of sarcoidosis is unique. Treatment plans are tailored to each individual, taking into account their symptoms, which organs are affected, and their overall health. Early diagnosis and appropriate treatment can help manage the symptoms and improve quality of life. So, if you or someone you know is experiencing symptoms suggestive of sarcoidosis, don't hesitate to seek medical attention. That was a lot of information about sarcoidosis, wasn't it? Let's do a quick recap. Sarcoidosis is a rare disease characterized by inflammation that leads to the formation of granulomas, or small lumps of inflammatory cells in various organs. The most common site is the lungs, a condition known as pulmonary sarcoidosis. These granulomas can affect the functioning of the lungs and in rare cases lead to complications like pulmonary fibrosis or bronchiectasis. The precise cause of sarcoidosis remains a mystery. It is speculated that bacteria, viruses, chemicals, or even genetic factors might trigger it. Symptoms can vary greatly depending on the affected organs, and many individuals may not show any symptoms at all. Diagnosis involves a comprehensive medical history, physical exam, and various tests. The primary goal of treatment is to control symptoms and improve organ function, often involving steroid medication or other immune-suppressing drugs. Some cases might not require any treatment at all. Remember, knowledge is power. Understanding rare diseases like sarcoidosis can help us be more aware and empathetic towards those affected.